All right. So again, welcome. My name's Elisa. I'm a dietitian with Kelly's Choice, and the topic is disordered eating for this month's webinar. So as we normally do with these topics, just start out with some facts here, starting with the first one on the slide, which is in the United States, 20 million women and 10 million men suffer from a clinically significant eating disorder at some point in their lives. 4 out of 10 individuals have either personally experienced an eating disorder or know somebody who has. The National Institute of Mental Health reports that 2.7% of teens aged 13 to 18 years old do struggle with an eating disorder or disordered eating. So let's talk about some of the differences here and just some, we're going to talk about some signs and things to look for. So with disordered eating, it's referring to a very wide range of abnormal eating patterns or eating behaviors. Many of these are shared with truly diagnosable eating disorders, but they are there are some distinguishing things in between these. So disordered eating is a disturbed and unhealthy eating pattern. It can include restrictive dieting. It can include compulsive eating. It may include skipping meals. And then the main thing that differentiates disordered eating from an actual diagnosed eating disorder is really the level of severity and frequency of behaviors. So again, the eating disorder diagnoses are made by a medical provider, a doctor, a psychiatrist, a psychologist. So here are some examples of some different patterns that of disordered eating. Fasting or chronic restrained eating, not to be confused with intermittent fasting. Again, think of the severity of this, maybe even the mental component and thinking around the functioning of the person around their eating habits. Skipping meals, binge eating, self-induced vomiting, restrictive dieting, unbalanced eating, such as restricting a major food group, such as fatty foods, somebody that will refuse to eat anything that has fat in it, or restricting carbohydrates, refusing to eat anything if it's a carb. That can, get a little bit dangerous with the recommendations and the misconceptions around a lot of what I like to call diet culture these days, because we do have, very low carb diets that ultimately can become it can trigger some disordered eating behaviors when we think that a certain food, we're labeling it as bad, and then we feel like we're not supposed to eat it, and then identify as being bad ourselves if we do eat it. So these are the types of behaviors that can get really unhealthy if we're not careful. The use of laxatives, diuretics, enemas, using those as a way of purging, steroid and creatine use and supplements that are designed to enhance athletic performance and alter physical appearance. And I know this is not a very uncommon practice, but again, it's looking at the behavior, almost a compulsive or obsession around the use of these substances. And then, of course, using diet pills as well. All right, so some common types of eating disorders. We're probably all pretty familiar with anorexia nervosa, and this is when a male or female suffers from anorexia, that they typically have an obsessive fear of weight gain. They refuse to maintain a healthy body weight, so their weight is not supporting their health and longevity. And then they also have an unrealistic perception of their body image. So body dysmorphia is what we would call that. And then another type of eating disorder is bulimia nervosa. And so this is characterized by repeated binge eating episodes, followed by behaviors that are going to compensate for the overeating, such as forced vomiting is one of the most common that we tend to think of related to bulimia, but it can also include excessive exercise. It can also include extreme use of laxatives or diuretics, any type of a compensatory behavior following the overindulgence, the binge eating. And then this is somewhat similar, but then there is also an eating disorder referred to as binge eating disorder. And so those who suffer from binge eating disorder frequently lose control over their eating. So they do have those episodes of binge eating and overindulgence, excessive indulgence. But the difference between this and bulimia nervosa is that it's not followed up with those compensatory behaviors like the purging, fasting, or excessive exercise. But they do have, maybe several times per week of these binge eating episodes. They are certainly followed typically with feelings of guilt and shame, but not these specific behaviors here. So what are some signs and some symptoms of disordered eating? So things to kind of look out for that may include one or more or all of these: chronic yo-yo dieting, frequent weight fluctuations, extremely rigid and unhealthy food and exercise regimen, that should say, feelings of guilt and shame when you're unable to maintain food and exercise habits, a preoccupation with food, with your body image, with exercise, to the point that it's causing distress and has a negative impact on the quality of life. So also compulsive or emotionally driven eating, use of compensatory measures like we discussed, such as exercise or food, and restriction, fasting, and then purging or laxative use to make up for the food consumed. So some of these you may look at and say, oh, well, geez, I definitely have weight fluctuations, or, my partner is constantly yo-yo dieting over the years. And if you recall from one of our previous, it may have been last month's webinar, and the fact that 50% of people in America are on a diet at any given time. And so a lot of us are chronic yo-yo dieters, and that's kind of unfortunately the norm. But what I would ask is looking at some of these other patterns, and again, behaviors around this, your state of emotion and body image, and is it a interfering thing in your life? Does it interfere with day-to-day behaviors? That's the type of thing that I would look for that would kind of raise some red flags here. And we know that there are detrimental consequences that can be involved here when you have these behaviors and disordered eating or eating disorders. So this can include a greater risk of obesity and eating disorders as you continue with this obsession around what you are eating and what you can't eat. That can just perpetuate the issue. Also, if you are yo-yo dieting as a result and a part of this behavioral pattern, every time weight is gained back, it's gained back in the form of fat mass, which then puts you back into that mode of, wanting to go back into a restrictive diet again. So it really can become a very vicious cycle. People that are affected by eating disorders can suffer from bone loss, from gastrointestinal disturbances, electrolyte and fluid imbalances, which can affect the heart rate. So causing a lower than normal heart rate, lower than normal blood pressure. It also increases levels of anxiety and depression. Social isolation can definitely be a factor here that's involved. So how can we kind of turn the tables a little bit here and think of some healthy eating habits? And so this isn't very different than what we typically teach about eating a healthy, well-balanced diet. And that is trying to stick to a regular eating schedule. Going back to the idea of intermittent fasting, I always say that's not wrong in and of itself. Just be cautious about what types of patterns you're starting to develop around that. Sorry, it looks like I got someone else in my waiting room. I apologize. Just want to make sure. Okay, I'm trying to keep my eye on it. So sticking to a regular eating schedule. You might be used to skipping meals or fasting for long stretches, especially if you've been doing a diet that is teaching those types of methods. But what I find with a lot of the patients that I work with is when you're doing a diet like this and you feel like you're just starving and you're not allowed to eat and listen to your body when you feel like you're supposed to be eating and the diet tells you you shouldn't be, it really becomes all that you can think about, right? It becomes that obsession of when can I eat next? What am I going to eat? And if this starts to interfere with your day-to-day just living, this is when it can become a problem. And so we really encourage sticking to just a regular eating schedule, whatever that looks like for you. But typically we do recommend a breakfast, a lunch, and a dinner. And as long as those are well balanced, well rounded, you're not over restricting, you're meeting your energy needs, that can set you up for really good, healthy eating habits. Challenge your strict eating rules. Strict rules about food and eating, it does just fuel the eating disorders and can really trigger the onset, especially depending, again, on your genetic predisposition, looking at your overall exposure around you and taking that into consideration and being a little bit more flexible about what you are eating is going to be really important to do. Staying away from diets. We at Kelly's Choice, we constantly, our whole thing is we're real people promoting real food. We're not promoting diets. There is such a huge emphasis on diet culture. And it's not anything new. We can go all the way back to the low-fat days of, Atkins diet, the Pritikin diet. This isn't anything new. We've been dieting forever, right? But we want to get away from that idea of I'm on a diet and I have a short-term goal to meet. And then, I can't wait to get off this diet. We're trying to promote healthy eating. That is going to be the key to just maintaining a good, healthy weight or promoting a healthy weight. So instead of focusing on what you shouldn't eat, and I teach this all the time, a lot of people will come to me with the idea that I'm about to tell them, okay, don't eat this, don't eat that, make sure you stay away from this. And that's just a negative approach around food. And if you're anything like me, I love food. I appreciate food. I don't want to have a negative relationship with it. In fact, it's why I became a dietitian, to be honest with you. I wanted to have a good, healthy relationship with food. And so when we're focusing more on what's going to nourish our body, what is going to give us the energy to fuel our day, to fuel our exercise, our energy levels, the nutrients that we need, that can promote a much more healthy attitude around food, as opposed to what do I need to avoid and restrict. So the next couple of slides, I'm going to go through some misconceptions about eating disorders and just kind of setting the record straight on some of these common thoughts. So the first one is that you have to be underweight in order to have an eating disorder, that if you are not underweight, then there's no chance, that you would have one. And so this is not true. People with eating disorders come in all shapes and sizes. Many individuals that we come across that have eating disorders are actually of average weight, and some are overweight as well. Misconception that eating disorders aren't really that dangerous. They're not, it's not life or death. It's, we can fix this. All eating disorders can lead to very life-threatening health problems, irreversible problems, heart disease. We mentioned that it can affect your heart rate. Your heart becomes weak. It's a muscle. And if you're starving yourself, your heart muscle becomes weak and it can't pump your blood as efficiently. So it can cause heart disease, bone loss, stunted growth, infertility, kidney damage. Some of these are life-threatening problems that are very serious and associated with eating disorders. So it's definitely not something to be taken lightly at all. Another misconception is that only women or only teenage girls are affected by eating disorders. So this is the most common population that's affected. That's true. That is the more common population, young women in their teens and early 20s. However, like we said, all shapes, all sizes, both men and women are all affected and can be affected by eating disorders. So how do we address this? Maybe we're recovering or helping someone recover from some disordered eating behaviors, and you're trying to get back on track and really restore your health. So we mentioned a few slides ago about trying to get yourself into a healthy eating pattern, breakfast, lunch, dinner, not stretching in, between meals for too long, not starving yourself. So that's one of the first steps, is just trying to get back that healthy eating pattern. But then the eating disorders that we talked about can also take a major toll on our healthy gut bacteria that lives in our large intestine. So it's really critical to rebuild those bacterial colonies, because if you don't do that, you're not going to be able to absorb your nutrients effectively. So we really need to have our gut flora intact. And so we have to rebuild that. So that might look like taking probiotics. There's really not one super quick just solution to this. It really kind of is multifaceted. It is a progression. It's not something that's going to happen overnight, because quite frankly, there's been a lot of damage done to the cells that are responsible for absorbing nutrients. And so they kind of need to be reactivated, brought back to life again. So one of the ways, again, is to do this with probiotics. And so, yes, there are probiotic supplements out there that we can recommend, but they're also naturally occurring in fermented foods. So this is going to be the most cost-effective way to just rebuilding those digestive enzymes in those cells that absorb nutrition. So some examples of fermented foods are going to be yogurt, and then lacto-fermented pickles, these are pickles that are not your most commercial pickles. You'll see if you look at the ingredients, it has vinegar in them. That's not what you want. The vinegar is actually going to pickle the cucumber as opposed to fermenting it, and that is a different process. The fermentation is what is allowing the growth of that beneficial bacteria that you're going to then ingest, and it's going to populate your gut. The vinegar doesn't have the same effect. That actually is going to kill the healthy, beneficial bacteria when you pickle something. Kimchi is also a fermented vegetables, sauerkraut, kefir. So again, make sure your sauerkraut, it doesn't have vinegar in it. Most won't. There's a really great brand called Wild Brine, if you want to write that down, that has an array of flavors. If you are not turned off by sauerkraut, some people, they just can't handle even the smell of it, but it's really, really good for your gut health. And this brand Wild Brine has a lot of different flavors and different vegetables that they ferment. So it might be fermented cabbage, fermented beets, so dill flavor, garlic, apple and fennel. So if you see that in the grocery store, I encourage you to pick some up and try it out. And all it takes is maybe a couple of forkfuls on your dinner plate or with your lunch as a side. And that's going to really help support your digestion of that meal that you're eating. So getting in the habit of doing fermented foods, really excellent for our gut health. So while fermented and fiber-rich foods can, of course, help to start to build up that healthy flora. By the way, I don't think that we really mentioned this, but the fiber specifically is what we refer to, if you've heard of prebiotics. So we've got probiotics and prebiotics. The fiber is a prebiotic, and that acts as a food for the bacteria. So you're replenishing the bacteria with the fermented foods. And then you're eating a fiber-rich diet so that the fiber can feed and fuel that healthy bacteria and allow it to repopulate and really flourish in the gut. And so these are really important for that, building back your healthy digestive system. But on the other side of things, the ones that we want to avoid or limit, that can actually have the opposite impact and kill off that bacteria and allow it to not thrive. And that is going to be very heavily processed foods, foods that are known to be loaded with pesticides and chemicals, high sugar foods, things like that are going to not be very beneficial for the gut flora and can actually start to destroy them. So not to get in again to the mindset of you can never have these and they have to be off limits or they're bad foods, just the mere awareness for you of what can harm it and what can promote it. I'm the first to say that there's nothing off limits as part of a healthy, well-balanced diet. So again, we don't need to label them as good or bad. Just knowing what you do more often than not is going to make the biggest difference in your health. Oh, and I got ahead of myself, sorry. So now we're going to talk about fiber. Again, this is what's going to feed the healthy gut flora, the adequate fiber in the diet. So the recommendation for dietary fiber every day is about 25 to 30 grams of fiber for the day. So if you want to divide that out between each meal that you eat and trying to make sure that you're getting maybe 5, 8, 10 grams of fiber, whatever that looks like each time you eat a meal, I would suggest to introduce that slowly. Don't get to that goal number overnight, because it's going to cause a lot of discomfort. If you're not used to that kind of fiber, start out slowly. Otherwise, it can cause some bloating, gas, constipation. You're going to be miserable if you do too much too quickly. But how do we do this? How do we introduce more fiber? I will also be the first to say it's not through Metamucil. It's not through a fiber supplement that you pour into your cereal. Or whatever it is, your smoothie or whatever. We want you to eat real food, the food that naturally has the fiber in it, which is also going to include all of the wonderful vitamins and minerals and enzymes and other great plant compounds that are a part of that food. If you're just taking a fiber supplement, it's going to be likely in a very isolated synthetic form, and your body is not going to recognize it as well as it would from the food. And plus, you're then just depriving yourself of all the great nutrients that would normally come in that food. It's just part of nature. And so reintroduction of adequate fiber, really important, especially if there has been any laxative abuse. Really important to get those bowels learning how to really function properly again. And as we mentioned, this is a process. This does not happen overnight. And so just to be patient, these are just little steps that can lead you back to more of a healthy eating pattern and digestive system. Taking a probiotic supplement can dramatically speed up this process. And so, incorporating the probiotic foods is going to be really important. But then if you really want a good therapeutic dose of probiotic, then you want to make sure that what you're looking for has many different strains of bacteria. So my rule of thumb is to look for something that has at least 8 different strains. So you might pick up a probiotic and it might just say like, there's a strain called Bifidobacterium breve. That's one strain. And while that strain may be very beneficial for a very specific thing, and I couldn't tell you off the top of my head what they're all for, but there are so many different strains. For something like replenishing the gut in general, you want something with at least 8 different strains in it. And then that's going to help to really repopulate that gut flora in a good way. It says to make sure that you store your probiotics in the refrigerator so that you can keep those cultures alive and active. I will say that I had spoke with someone who was in research that said that nowadays the most current probiotics that you find in the stores are formulated in a way that they do not need to be refrigerated. You wouldn't want to keep them like in a hot car or anything, of course, but they're okay to stay at room temperature. You don't have to, throw anything out that you might have that hasn't been in the refrigerator. Is really. So looking at intervention, which is going to be really important. So whether it's something that you're going through, if you have a son or a daughter, a partner, anybody that you are helping to care for that could be going through something like this, you can't do it on your own. You're going to need some professional intervention and some help and some support, because this is a journey. This is a process, and it's very multifaceted with everything that's involved with the behavior changes, the mindset and the skill set that's around that. A mental health clinician is going to be going to play a really critical role in this process. A doctor, if there's any medication involved or prescriptions, and having that medical intervention is really helpful as well. And a registered dietitian, this is where, we can help with working with the patient to develop truly symptom-free relationships around food, helping to understand what does that healthy behavioral pattern look like? What does, what should my day look like? Our minds become extremely, our thinking process becomes very warped when we go through something like this. And so you need that support of, well, what does healthy even look like? Because we forget, it's been so long since we've had healthy eating behaviors. So just to point out the difference here, because there are many, many, many people that practice nutrition, that talk nutrition, that post things online about nutrition. So there are differences here between a registered dietitian who is more a part of the medical team versus a nutritionist. Some distinct differences here. So a registered dietitian is accredited through a national medical accreditation, the Commission of Dietetic Registration, as well as holding a bachelor's, most a master's degree in dietetics, which takes you through a specific medical nutrition therapy trajectory towards clinical care. For patients and individuals that have chronic lifestyle related diseases. And then a nutritionist sometimes can maybe just complete a course in nutrition or have a certification. It's not as rigorous as what a registered dietitian does go through. Now, that's not a blanket statement, because I know nutritionists that don't have that registered dietitian credential, but they have a master's degree in nutrition and or a doctorate in nutrition. And of course, they definitely have a wealth of knowledge to be able to share. But when it comes to more of the medical conditions, you definitely want to gear your sights towards a registered dietitian who works closely with medical providers. All right, so that was a little bit heavier topic than what we usually go through, but I hope that you all learned something and at least have been able to understand the signs and symptoms, any red flags, even when it's related to different eating disorders or disordered eating patterns and behaviors. So I want to thank you all for your attention. This was an amazing turnout. This is one of our highest turnouts ever. So I really do hope that you got a lot out of this. It was recorded. So as usual, as we always do each month, I will make sure that we get these all sent out to you, the slides, any associated PDF files, as well as the recording, so that you can have this as well. All right. I hope you guys all have a great rest of your day and a great weekend. Thanks again for joining.